So thigh gap surgery, what is it, who is it for, and what can you expect? You may have heard of the thigh gap, a space between the inner thighs that some people naturally have and others seek through procedures or surgery. But is thigh gap surgery safe? Who is meant for it and what you should expect if you're considering it? Let's talk about the procedure, what it really involves, and who is right for it. What is a thigh gap? A thigh gap surgery is a procedure where we do a liposuction of the inner thigh and in some cases skin tightening as well. The goal is to reduce the excess fat in the inner thighs and reduce the chafing that happens between the thighs and reshape them to create a more defined space between them without compromising function or mobility. Who is it for? The procedure is best suited for people who are almost an ideal body weight. They have some stubborn fat in the inner thighs that don't respond to diet or exercise. They have good skin elasticity. It's not for extreme weight loss or drastic reshaping. Genetics also play a big role. Some people naturally have a thigh gap due to their bone structure or just that they're thin, while others may have to achieve one after surgery, and that's okay. What happens during the procedure? During the procedure, we inject a fluid into that area which kind of swells up the fat and makes it very easy for us to remove that fat from the inner thighs. In some cases, especially if there's a lot of loose and hanging skin, we add a thigh lift which involves removing and tightening extra skin. The procedure is typically done under local or general anesthesia and may take about 1 to 2 hours. The scars are placed discreetly along the inner thigh or the groin area, and there are never going to be any signs that you have undergone this procedure. So how is the recovery and the results? Most people return to light activities within a week and resume full movement in about 2 to 3 weeks. You will wear compression garments to reduce swelling and support healing. Bruising and tightness are very common for a few days, and we guide you through safe movement to avoid complications. See, the final results are always going to be seen after 6 weeks as the swelling slowly subsides. Manage expectations and body confidence. Not every patient will develop a visible thigh gap, and that's important to understand. One important goal is natural contouring, proportion, symmetry, and not just chasing unrealistic trends. In fact, for many people, improving the inner thigh shape results in just better comfort, improved clothing fits, and greater confidence, even if the gap that is seen is dramatic. So thigh gap surgery is more than just a trend. It is about confidence, proportion, and choosing what feels right for your body. See, if you're considering it, start with a consultation to understand what's realistic for you. Don't follow trends. At Tara Healthcare, we focus on just ethical, individualized care that enhances, not alters your natural shape. I'm Dr. Karan. Thank you for watching, and I'll see you in the next video.